And I'd just like to personally thank you, Dr. Datuk, Dr. Chong Chi Kyong, for launching this event and also for launching the LSCCH Therapy Centre itself. And this is something I'd like to talk a bit about now, just to give everyone an insight into what the centre is about and an insight into a little bit how it came about, but also the benefits that it'll bring for people that are attending this conference, but also for the general public and beyond. So just for a moment, let me just share my screen. So the actual therapy centre itself, it's something that has, I think anyone who knows myself and knows Sheila Menon knows that we've been kind of planning this for a while. It started its genesis pre-COVID. Then, unfortunately, COVID came along, and a lot of things got put to one side, basically, and we ended up perhaps taking a little longer to launch than we would have hoped. But unfortunately, as I say, COVID itself was very much to blame for that. However, we are now in a position to be able to launch this therapy centre, and for the world, hopefully, and it is a global initiative, to be able to benefit from what we're doing. So the first thing to I'd like to share with you is our ethos, what we really are about with regards to what we're offering. So the first thing is very much, we are very aware that there is a global rise in mental health issues. Mental health issues are being highlighted more often in the press around the world, and people are actually seeking help for mental health issues as well. Perhaps, certainly in the UK, we have an issue with people who are trying to find mental health provision in an effective and timely way. And so what we're noticing is that with our NHS system, people are spending perhaps a year or more waiting for a proper consult for psychotherapeutic help. Now, we're also very much aware that people who are training in hypnotherapists have this wonderful idea of where we're going to go. They're great. They're with people during the training, and at the end of their training, they're put into the outside world. And then what? Yes, we do train, and schools around the globe do train about how to build or get your clients in and so on. But there is no real career pathway for hypnotherapists. So what we're hoping to provide with the LSCCH Therapy Centre is a form of career pathway, and you'll be able to see, I hope, as we go through exactly how this will fit in. And similar thing for therapists out there. And one of the things that we did find that when COVID hit was people having an income that dropped because they didn't know quite what to do, how to manage their own practice, shifting from being face-to-face to being online. And so the therapy centre is also there to try and give further career opportunities for existing therapists. And as you'll see, this is not just going to be about hypnotherapists. The centre is very much about the entire gamut of therapy, psychotherapies and beyond. And but what we're also very aware of, that not everyone can can pay huge exorbitant fees that some therapists do charge. So what we're looking is we're creating a fee structure and hopefully being able to provide an affordable route for therapy for the general public. Affordable route, something that people can stick with hypnotherapy, or whatever therapy they're doing, and be able to complete full courses of therapy without having to worry too much about, obviously, the fees that they're paying. Also, what we're wanting to do is provide a clinical placement scheme for students. So people who are in their advanced level of training, being able to initially with hypnotherapy, being able to go in and have access to members of the general public. We're often being asked or by people in the general public, or they volunteer to become subjects for our students to work with. So with the therapy centre, we're creating a structure of being able to take student education one step further and provide as part of the education a clinical placement element for the for students and budding therapists. And again, as I say, this is not just purely for hypnotherapy. As you'll see, we will be expanding into other forms of therapy. And we are a truly global endeavor. And so this is something that we need to bear in mind. We can give something back to a global community. Part of what we're wanting to do is social responsibility, and I'll be talking a little bit about that in a moment, but it's very much about as well giving back to a global community. And we are launching essentially in 2 phases. The first phase, which I rather think is probably going to be quite obvious, is for hypnotherapists. We are going to be providing with the BSCH an opportunity for hypnotherapists to step in, become involved. Hypnotherapy students will be able to step in and become involved too, as part of that. Then, as we move into the second phase here, this is where we really start to expand. We will be bringing in medical consultations. So we have a lot of interest from medical professionals around the world who will also want to become involved with it and be able to carry out through the system medical consultations. We'll also be bringing in other psychotherapies, and the system is set up that it will allow for things like couples therapy and for family therapy and for group therapy. I think we can hold up to about 12 people in one session if that is going to be required. So even bringing in an element of perhaps psychodrama or something like that. But also we'll be able to be bringing in non-psychotherapies, for example, nutritional therapists, who will be able to also do their consultations through this particular system. So you can see as we build the therapy centre itself, it's becoming an almost one-stop shop for whatever you're wanting to be able to have treated in whichever way you want to be treated. So what's in it for the client? The therapy centre will be able to do virtual, understandably, this is what we're talking about, a virtual appointment for people, or very much in-person appointments. There is a facility for those people who are registered as therapists within the centre to be able to put their details in, and you can book in a personal face-to-face appointment if that is what you wish as a client. There is, as I've mentioned before, an affordable price structure. I will be showing you a little later on the different categories of therapists that we'll be placing in there. And that category of therapists is also a little bit part of the career progression that we've been talking about. Certainly to begin with, therapists will have BSCH recognition and BSCH approved qualifications. So people who are able to become members of the BSCH, and our initial phase will be looking to bring patients, to bring therapists in from the BSCH itself. The idea here is we know and we understand the qualifications and the ethical practice of these therapists. However, as we expand, we will be working with other societies around the globe to expand or to ensure that the clients that are coming to us are able to see an appropriately qualified therapist. And we've also got the opportunity here, which is a very useful one, for therapists who will be conducting therapy in a variety of languages. As a client, I may not have English as my first language, and I can go somewhere and find a therapist quite easily who will be able to carry out therapy in my first language. So with the global connection, the number of people, I mean, when you look at the number of therapists in the BSCH and the different first languages our therapists have, then we do have a unique opportunity to be able to, as part of the whole scheme, to be able to put up and say, right, you're looking for somebody who speaks Farsi, or somebody who speaks Mandarin or Bahasa Malaysia or whatever language. We can do a search and help them find somebody who is a native speaker in that language. And we'll also have access to therapists with a variety of specialities. As we all know, as we have evolved during our own experience of building up our careers, people will have different specialities, and clients will be able to, potential clients will be able to search the website. Now, I'm coming in with post-traumatic stress disorder, and I want to see a client, I want to see a therapist who specializes in that. Well, they'll be able to search under that. You will also be able to, for example, search under child hypnosis, or if you're looking for a CBT therapist, or a nutritional therapist, or whatever it might be. So there will be access to a variety of different specialities for the client. And of course, throughout, there is also the knowledge that this is a confidential service, no matter where you're accessing it from within the world. This is confidential, and it meets HIPAA and GDPR compliance as well. So we've got a rather large number of therapists here. So what's in it for you, the therapist? Well, several things. One, you've got an ability to provide virtual and in-person therapy itself. Yes, I know, a lot of you are probably using Zoom and so on, but there are other benefits that will come from using this, using the LSCCH Therapy Centre. There is the ability to network with medical and other professionals. So when you might be looking to provide an integrative approach to a client's care, then you will be able to work with a psychiatrist, work with a medical doctor, work with a nutritional therapist, or somebody from a different profession, providing a truly pluralistic approach to treatment care. And also knowing that the centre is not just going to be sort of plonked in front of you and said, right, that's it. It is a very active centre. We've been getting a lot of interest from some very interesting sources in the centre. And so we will be actively providing awareness talks to the general public, along with producing meaningful news for the mental health professions, via our press releases, via our social media, via our contacts within radio and television and so on. So there will be a presence in the background that is promoting this very strongly. And we'll also, there will be a requirement for therapists to undergo clinical supervision, because what we're also ensuring is that there is the safety aspect for the client themselves. So there is the opportunity within the system to find a clinical supervisor, to undergo mentoring as well. And also you'll find that not only with this idea of creating press releases and so on, we do have a full marketing team that will be doing what they do and what they do very well for the clinic itself. So constant reminder for the public, constant connection with awareness as well. So what else are we looking at? There is invoicing and money collection, the old subject that people don't like to talk about. The issue of finances will be the responsibility of the centre. So clients will be invoiced, clients will be chased up for their payments and so on via the centre, something you don't have to do. And within that, there is also going to be a secure client management system as well, so that everything is through a particular, can be carried out through a particular dashboard, being able to follow, track clients, who they're with, who what they've paid, who monies that are owing to the therapist, etc. And we will have two ways of working with people. Obviously, through the presentation of our media onslaught and so on, members of the general public who come looking for a therapist, they will come and the first thing that will happen is they will be put into the system. They'll search out their particular specialities and how much they're wanting to pay, the type of therapist they want to see, and then the system by rota will allocate to the next available therapist, the next therapist in line. So we're wanting to ensure that new people coming in for therapy will be allocated fairly. No one gets missed out. And once a client is in the system with you, the therapist, then they will remain with you on the system. So once your client is allocated to you, if they're seeing you for nail biting, then they want to see you for smoking, then they want to see you for trauma or whatever it is, they will then be able to go with you throughout that. It's not a case of you see somebody once and then they're put back into the system. They are allocated to you. The client, of course, will always have choice. They can elect to stay with you, and through good rapport, etc., you'll be able to manage that. But they may choose to go and see somebody else, so they will always have that right of change. Now, with the secure client management system, the records are kept in a secure storage on our servers. But that doesn't mean to say you don't have access to your client records and you can't do anything but look at them online. You will be able to download your own client records, obviously nobody else's, but you'll be able to download your own client records for your own system of management of the records. And again, I like to talk about pluralism and so on. There will be a within system referral opportunity. So, for example, if you are working with somebody and you know a particular therapist who is very good at working with trauma and you want to refer your client to that person, or that client has a child that wants to be seen, but you aren't comfortable working with the child, but you know somebody like Caroline, who'll be talking to us at the end of the today, who works with children, then you can refer specifically to that person, or you can find somebody who you can refer to. And also, for example, recent situation I had where I needed to make a psychiatric referral, that will be managed as well within the system itself. So not only are we doing that, we're also providing it as what we would hope is a very, very fair cost. So, for example, we're not asking for any monthly fee or whatever it is. It's really kind of pay per use once you're accepted onto the system. When you see a client, a small percentage of the client fee will be taken to cover the administration, the advertising, the promotion, and very much the running costs of the platform. So we want to keep it as fair as we possibly can with regards to that. And I talked earlier about social responsibility. And social responsibility is very much at the forefront of what we are wanting to do with the platform. And obviously, the conference is about COVID. We're all very aware of everything that our frontliners have been going through during COVID. So we're looking at social responsibility, doing something for frontliners. As COVID continues, we are very much aware of the fact that we're still in this thing and the frontliners are still under pressure. But also, once COVID has finished, we want to be able to continue to provide some form of care for our frontliners beyond COVID. We're not just looking at doctors and nurses and paramedics, we're looking at people within the fire fighting professions, the police, and so on. And we're going to be working with the BSCH and with other organizations around the world to help gain access to this and to provide therapists for this. As it says, as I say, it's a global initiative, and it's going to be a pro bono mental health support. So we will ask, and we will not force, but we will ask therapists on our system to be able to give up 1 or 2 hours a month to be able to help work with our frontline responders. We will also be looking at the using our student clinical placements to also be a source of help for the frontline responders, depending on what it is that they will be working on. And it will be very much associated with their job. And we also look to promote other campaigns, basically looking to really try and gather as much support for frontliners as we possibly can within that. And basically, just to reiterate, not just for the pandemic, but after the pandemic is over, that is where we're looking to continue this. This is a long-term endeavor, and as popularity rises and the number of therapy rises, we may also be able to work with other charities and so on to help provide some form of care for the users of the charities as well. But that's future stuff. So we do have a website. It's very much finishing its construction, but the website is there. It will be heavily promoted. And will have many different functions. So, for example, you've got the ability here to search for hypnotherapists, psychotherapists, and so on. You've got clinical hypnotherapists with their own profiles. You'll be able to click in and see the full profile of a therapist and their particular specialities. And if somebody wants to book straight away with that person, they can there, or they can allow the system to allocate somebody for them themselves. So behind the scenes of the website, websites are nice, etc. But what's going on behind the scenes? Well, very much we have an online appointment system. And the idea here is that we'll be able to sync availability between therapists and the client and to create something that is very robust. client books in. Once they've booked in, you can then be sent a message. Your diary will be filled with that particular point, and it moves from there. But it's not just the booking that will happen. Once your client has booked, they'll get an automatic email that confirms the booking for each appointment that they've booked. And this is all handled by the system. Also, prior to your appointment or their appointment, they'll receive an automatic email and also SMS reminders about their appointment. So it can be set so that they can receive a reminder 1 week before, 24 hours before, and maybe an hour, especially for online appointments prior to that, to try and overcome the issue of no-shows and so on. And the whole invoicing and payment integration that's there, this is ensuring that there is a decent digital paper trail, and that's something that you, the therapist, can follow, and that it will be smooth flowing, it will be accurate, and especially, you know, one of the reasons we're all in therapy, we're earning a living, that you get paid in a very timely manner with regards to that. For those that, and we should all be concerned about this, but the system is HIPAA compliant and certainly GDPR compliant, and that's GDPR within whichever country we go to or where you're working in. So for the handling of the client records, there is a reporting system that's in place. So for those of you who are interested in statistics about your personal practice, number of no-shows, the number of sessions a particular client has made, the type of presenting symptoms that you're seeing and so on, there is a reporting system that will allow you to give insight into that. There is also a personal calendar system. So the client books in with you and you have a calendar system online that you're able to see, but you can also set the system up so that it sends only your appointments to your own phone calendar or tablet calendar or calendar you use on your computer. And we also have obviously the teletherapy element, and that is very much HIPAA compliant. That is very much tied in with the whole element of being able to see a client and know that you're not going to be looked in. You know, HIPAA compliance is the gold standard in America that the banking system tends to use and seems to become a gold standard globally. And what else is behind the scenes? What else is even more of benefit to you, the therapist? Well, there will be online intake forms that can be sent by you to your client in advance of a session or completed during the session. We can also set the system up so that when your client's confirmation of appointment is sent, an automatic intake form is sent to them that they can fill in. Once that's sent back, you will then immediately be able to look at that form. So a lot of case history taking and basic client information can be taken in advance. What also is very nice is that assessment tools are available on the system. And there are quite a few assessment tools available. So we can set it up that, you know, as with certain charities, perhaps with, you know, something like Anxiety UK, where every client gets PHQ-9 or GAD-7, that can be sent out. We can set it up that you just have access. You want to give one of these to your clients that can be sent out in advance by you or given to them and filled in during the therapy session. So DAS-21s, PHQ-9s, GAD-7s, whatever else might be out there. The other really nice thing about this is that where they are available, specific tools that are being calibrated in a particular language can also be available. I know, PHQ-9 GAD7, at least there is virtually available in every different language that's out there. So it's no longer having to give an English form to your client. They will be available for you to send out to your client in their language of choice. And not only that, there's also the opportunity, and this is not paid for, it's something that comes with the whole thing, for bespoke assessment tools to be created for you. So if an assessment tool is not online or not as part of the system, and you feel it would be nice to have it in there, then that can be added. But also in session forms, one thing that I want to, as somebody who uses EMDR, I'll be creating and having put into the system an EMDR information form, for example. We could do forms for hypnodesensitization, the scales that we can use, the visual analog scales, all sorts of things can be brought in. Because if you need it, then probably somebody else will need it too. And the type of therapists that we will be giving access to, or clients will be giving access to as well. So there will be the supervised therapist students who will be, people still in training. Then we will have, or clients will be able to choose from new practitioners, people who have just left their training and starting out as being a practitioner. So their first step on their career path. We will have practitioners who have a certain amount of experience, so acknowledging that after a few years, then you move into a higher level of income. And then if you are long in the tooth therapist, like yours truly, then you will then have the opportunity to become a consultant senior therapist on the system. So it's looking to give fair access to your clients, fair access to different people, and also you seeing a career progression as you go through being a therapist as well. And just to give you a little bit of imagery from the system. So here is the what we would call the dashboard. Now this is an admin view of the dashboard. You as an individual therapist would only see your name, everything else will be blanked out. So you'll be able to see your name, keep an eye on who your clients are, being able to click on the client section and then see what there is about them, all the attachments that there are. You will also get the opportunity to be able to send perhaps a text message or an email to them via the system, and within that it collates the messages that have been sent to you or sent by you, all under that one particular client's record. So you don't have to sift through 600 different messages that you might have. And the reporting system. So we've talked a little about what you will be seeing, and this is just a little part of what it is if you would want to look at what you're doing. There is a variety of ways that are standard, that are set up, and if we want something new, then we can set that up as well. But also very usefully for us, for the marketing of the centre, there's also an ability to look at the sources that our clients come from, how many people have come from that source, the average amount of money that's being spent, so that we can target advertising appropriately on your behalf and on behalf of the entire centre. And I'm very aware of my time, but just to give you an idea, as a client might see for a teletherapy appointment booking, you've got the option here coming in of clicking on a teletherapy session or making a main appointment face-to-face, or there's a callback option where somebody can phone the client back and just give them a little bit more information about the session. They can then click on video consultation, see a little bit about the consultation, what it would involve, and then if a therapist has been selected, or when the therapist has been selected, then you get to see a little bit about your therapist. Then you can either accept or ask to see another therapist. Once you accept, you then have the date that you're looking for, and it will be very much associated with your availability as the therapist. So if you're not available on weekends, that'll be blanked out. If you are available on weekends, that will be there. Once they click on that, you've then got the time for your therapy appointment, and that can also is something that can be adapted for your own personal timings. Once you've done that, you get a little bit more about the video consultation, put in some details. Then what will happen to ensure that you're not being booked up by people who are trying to sabotage you, for example, the client will be sent a code to their phone in order for them to then prove they are an authentic person, and they just enter the confirmation code in here, and then they're through to here with details about the appointment. There is an app they can download with iOS or with non-iPhone Android apps. And then they're set up ready for their appointment. And there's a very similar thing for face-to-face consultations as well. So you've got the consultation, you'll then get the address of the consultation, and so it goes through in exactly the same way, always with this confirmation to prove the client is who they say they are, sending it through to a telephone for them. And I'm very aware that this is only the start. So the future, and I've mentioned some of this, what's coming up in the future? Well, there are the medical consultations, which is something that is very much seemingly in demand. We've got the other psychotherapies coming in, and we've got the non-psychotherapies coming in. Anything that can be done through a virtual environment can come and join the centre as well. And we've got the within clinic referral system. Also, we will have, we've been getting interest, and there is, I'm not saying too much about it, but we have interest from the academic university sector already, and we've not really advertised this at all. So there is that element that's also coming in, and very much that's useful for you guys, being able to give multidisciplinary care packages. So a client can come in and they can choose just to see one therapist, but at the same time, they can see, oh, there's a special package for weight management where you're going to have somebody who is a therapist, hypnotherapist, for example, who can do the mind work. You've got then, you've also got access to the nutritional therapist to help with the your nutrition, perhaps a physical therapist, a trainer who will be able to work with you to look at your fitness, and access to a doctor to check that there's no medical conditions going on. So it will become a very in-depth and elaborate system for the clients, but one that will be easy to use, and hopefully just gives this new dynamic in client care, certainly from within the hypnotherapy profession. So basically, where we're coming from with this, ostensibly originally, it came from the British Society of Clinical Hypnosis. The BSCH members will be able to become members of the clinic. There will also be opportunity for a APSCCH members to become, and other organisations as well. People being trained by the LSCCH and the London School College of Clinical Hypnosis Asia, and other psychotherapy training organizations will also be able to benefit. It's going to be building up and building out as we go on. We're starting and keeping it at a manageable start. Then as it builds, we will build along with it. So I'm very aware that we need to hand over in a moment to somebody else, but if you want any more information, tomorrow I will be in one of the breakout rooms for you to come and talk to me. Don't have to be there tomorrow. The bottom of your screen is an email address for you to be able to send your queries to. And once you've done that, hopefully we'll be able to welcome you into the therapy centre itself. So I'll ask the team behind the scenes to put up that email address in the chat, and I will be open now to any questions that people would like to ask.
Thank you, Peter. It may be a virtual conference, but I can feel the excitement in the chat box. So there's definitely a lot of excitement there. A lot of questions, but in lieu of time, I think you've mentioned, because there's a lot of questions about how the therapist can register, but I think you've made that quite clear by saying that it's via the organizations or the associations that they can sign up, yes. Right? Okay.
At this moment in time. So we want to ensure that people have the right training from people we trust.
Right. And that would also apply to how you classify the therapist, because you had a few, there's a range, and then the few sort of groups. Yeah. So I think, I guess maybe you want to comment on that. How would you categorize
It's basically being, the idea is that you can be a student. Once you've graduated, then you become the first level of therapist. After, I think, if I remember rightly, it's around about 4 to 5 years, you can then move up to the next level, and then on to the consultant level, somebody who's highly experienced. And again, we'll be looking at things like CPD that you've been taking, wherever you've been doing it, looking at client hours and so on, keeping up with clinical supervision and all of that, because ultimately we are responsible to the general public, and we have to know that we're presenting people to the general public who the general public can trust. And we know we can trust. So, as I say, it's things like being a member of the BSCH. So, there are several different schools whose graduates can become members of the BSCH. They will all have access to this.
Okay, Peter, we've got other questions which we're going to compile for you, and we'll get back to the participants with the response. Thank you so much, Peter, and I'm going to pass it back to Tom. Yeah.